Most people recovering from sciatica make one of two mistakes. They stop moving entirely, or they keep training and make it worse without knowing it. I've seen both in my patients. The ones who rest too much let fear run their recovery. The ones who push through sharp, shooting leg pain come back worse than when they started and have no idea why. Here's the truth. It's not about whether you exercise, it's about which movements you choose to do and when. In this video, I'm going to show you exactly which exercises tend to aggravate sciatica and which movements are actually safe while you're healing. And stay to the end, because I will also give you my 4 rules for exercising when in pain and recovering from a condition like sciatica. Miss even one of these rules and you could be extending your recovery by weeks. I'm Dr. Philip Cordova. I've been a chiropractor for over 29 years, located here in Houston, Texas, and I've helped thousands of patients with disc bulges, sciatica, and leg pain get their life back without surgery using chiropractic spinal decompression and other therapeutic modalities like pulsed electromagnetic therapy. How can you tell if the exercise you're doing is helping or worsening your sciatica? I want to start here because if you don't understand this first, every exercise decision you make will feel confusing. When people develop sciatica leg pain, they usually respond in one of 2 ways. They either stop exercising completely because they're afraid of making it worse, or they continue pushing through the sharp pain because they assume discomfort is normal. Both reactions come from misunderstanding what pain actually means during recovery. You can exercise with sciatica, but you cannot ignore what your symptoms are telling you. There is a clear difference between muscle soreness and nerve irritation. Soreness in the glutes after training, mild core fatigue the next day, a feeling of having worked the muscles that support the low back, that is typically tolerable and acceptable. Sharp pain in the low back, burning pain that travels down the leg, symptoms that increase during the workout remain worse afterward, that is not usually tolerable nor acceptable. That pattern usually means you are aggravating the irritated nerve rather than building a more stable and supported low back. Continuing to exercise, especially if that is something you love to do, can absolutely be part of your recovery. Movement improves circulation, maintains strength, and prevents unnecessary deconditioning. What slows recovery is repeatedly crossing the line into nerve irritation without realizing it. Your job is not to avoid all discomfort. Your job is to monitor whether your symptoms are escalating or staying controlled. If pain is stable or gradually improving, you are likely within a safe range. If each exercise leaves your sciatica leg pain more intense or more frequent, something about the movement, load, or repetitions needs to change. Once you understand how to read your symptoms correctly, the next logical question becomes clear. Which exercises are most likely to push you past that line, and which ones actually help create the stability your low back needs? To understand why certain exercises flare sciatica leg pain, you need a basic picture of what's happening anatomically. The sciatic nerve exits through the buttock, but it is formed from the L4, L5, and S1 nerve roots as they merge with the rest of the sacral nerves. If you have a disc bulge, a disc herniation, or abnormal loading of the spine, those nerve roots can become stressed, compressed, or tensioned. When that happens, pain can travel from the low back into the buttock and down the leg. So every exercise decision comes down to this question. Is this movement increasing compression or tension on those nerve roots, or is it helping create stability and reduce stress on them? Let's start with exercises that commonly aggravate sciatica. Heavy back squats increase axial loading through the spine. As the bar gets heavier, compressive forces on the lumbar discs increase. If you already have a disc bulge or herniation, that added load can increase pressure around the L4, L5, and S1 nerve roots. If core control is weak, the spine may subtly shift under load, further stressing irritated tissues and increasing sciatica leg pain. Heavy deadlifts can do something similar, especially if performed with poor mechanics. When the spine flexes under load, even slightly, disc pressure increases significantly. That can place additional stress on the posterior portion of the disc where herniations often occur. If the nerve roots are already sensitive, that extra compression or tension can trigger burning or sharp pain down the leg. Unsupervised deadlifts add another layer of risk because many people are unaware when their form breaks down. Small deviations under heavy load can create significant stress on the lumbar spine, which then translates into irritation of the sciatic nerve roots. Now let's talk about exercises that tend to support recovery instead of aggravating symptoms. Glute bridges strengthen hip extension while keeping the spine relatively supported and neutral. Stronger glutes help offload demand from the low back during daily movement. When the hips generate more force, the lumbar spine does not have to compensate as much, which can reduce ongoing stress around irritated nerve roots. Lunges, when controlled, challenge hip stability and glute strength without placing the same compressive load through the spine as heavy barbell lifts. By improving single leg control, you reduce abnormal loading patterns that may otherwise shift stress into the lumbar region. Lighter back squats can sometimes be appropriate because they allow you to practice controlled movement with manageable spinal load. The key is not chasing intensity, but reinforcing good mechanics and stability. Plank holds are valuable for core strengthening because they build endurance in the muscles that stabilize the lumbar spine. A stronger, more coordinated core limits excessive motion in the lower back. Less uncontrolled motion means less repetitive stress on discs and less irritation to the L4, L5, and S1 nerve roots. The common theme is stability over maximal load. Exercises that increase compression, tension, or abnormal loading of the spine tend to aggravate sciatica leg pain. Exercises that improve glute strength, core stability, and controlled movement patterns tend to support recovery by reducing stress on the irritated nerve roots. Once you see how each movement either increases or decreases stress on the sciatic nerve system, you stop guessing. Before I tell you my 4 rules for exercising while recovering from sciatica, let's quickly recover what we have covered so far. You now understand why certain exercises like heavy back squats or heavy or unsupervised deadlifts can aggravate sciatic leg pain, especially when there's a disc bulge, herniation, or abnormal loading of the spine. You also know how glute strengthening, core strengthening, lunges, lighter back squats, glute bridges, and plank holds can help create a more stable and supported low back. This gives you direction on what to avoid and what to prioritize, but exercise selection alone is not what determines whether your sciatica improves or keeps flaring up. That's where these 4 rules come in. They seem simple, but when followed consistently, they can help prevent flare-ups and even speed up healing and recovery time. Here are my 4 rules for exercising when recovering from sciatica. The first rule is to continue to exercise as long as you are not making things worse. Exercise is still good. Movement helps maintain strength and prevents unnecessary deconditioning. Soreness is okay. Sharp pain or burning pain down the leg is not okay. If your symptoms increase and stay elevated, that is your signal to adjust. The second rule is to avoid heavy back squats and heavy deadlifts, especially if deadlifts are unsupervised. These lifts place higher demand on the low back. If form breaks down or the load exceeds your current capacity, you may increase stress on irritated tissues and aggravate sciatica leg pain. The third rule is to work on glute strengthening and core strengthening to support the low back and take pressure off the hip rotators. A more stable and supported low back reduces abnormal loading and creates a better environment for recovery. This is where your focus should be during this phase. The fourth rule is not to start extreme exercise if you have not been doing that. Recovery is not the time to suddenly increase intensity. You can use movements like lunges, lighter back squats, glute bridges, and plank holds to build strength in a controlled way without overloading the system. When you follow these 4 rules consistently, exercise becomes something that supports healing rather than something that triggers flare-ups. That is how you continue training, protect your low back, and give your body the best chance to recover from sciatica leg pain. You now know which exercises tend to aggravate sciatica leg pain and which ones are generally safer to use during recovery. You also have a clear set of 4 rules that can help you continue to exercise without making your symptoms worse. They seem simple, but they work when you apply them consistently. If you found value in this video, take a moment to like it and share it with someone who is dealing with sciatica. Drop a comment below and share your thoughts, or ask a question if you are currently struggling with sciatica leg pain. Let us know what you are experiencing. And if you want to keep learning how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable tips you can use right away, make sure you subscribe to my channel. Now, the next video you should watch is this one. If you want to see the 5 top exercise moves I recommend to help relieve sciatica leg pain, go watch this one next.